Okay, I'm gonna get my dispatch.
You are a non-transporting basic EMT ambulance. You were dispatched to the residence of a 7-year-old male complaining of chest pain.
Okay, perfect. I'm gonna put my appropriate PPE on. Is my scene safe?
Your scene is safe.
Okay, perfect. I'm going to determine my number of patients.
Just one.
Okay, and then I'm going to determine the mechanism of injury or nature of illness.
You find a male laying in bed clutching his chest.
Okay, and then I'm going to request a additional EMS for him, and then I'm going to consider stabilization of the spine.
The spine is stable.
Okay, and then I'm going to move on to my general impression.
You find the male laying in bed clutching his chest, and he greets you as you walk in the room.
Okay, so I have also determined my level of consciousness. He is alert, he's talking to me, and then I'm going to determine his chief complaint.
I'm struggling with chest pain.
Okay, chest pain, and then I'm going to assess my ABC. So his airway's good, he's talking to me, he's breathing. I'm then going to assess his lung sounds, see how those sound. Can I have you lean forward, sir? Thank you. Have you breathe in and out. And then one more time for me. Good. And then what do I hear?
Your lung sounds are clear, equal bilaterally.
Okay, perfect. And then I'm also just going to go ahead and get all my vital signs right now while assessing also my circulation. Do I see anything wrong with his skin? What's it looking like?
Skin is pale, cool, and clammy, but not cyanotic.
Okay, perfect. And then I'm going to assess his circulation, or not his circulation, take his pulse. Okay, can I have you look that way? Thank you. And then what's my pulse?
80 beats per
Okay.
minute.
And is it even?
Yes. Strong and regular pulse at 80 beats per minute.
Okay, and then I'm gonna have you look that way one more time and get my rates per minute, my breaths. What's that?
16.
Okay, and then I'm going to take your blood pressure. Is that okay?
Yes.
Okay, put this on. Take your blood pressure. And then what's my blood pressure looking like?
124/86.
Okay, perfect. And then I am going to move on to my history. I'm going to start with my onset. So what were you doing when this happened, sir?
I was mowing the lawn.
Okay. And then also, since I just took my vitals, I'm going to decide to transport him as well. And then going to continue with my history. So you're mowing the lawn. Does anything make it worse or better?
Worse upon exertion, but it feels better with rest.
Okay, perfect. And then I'm going to move on to my quality. What's the pain feeling like? Pressure? Is it anything?
It feels like pressure in your
Okay.
chest.
Pressure, okay. And then is it radiating anywhere? To your stomach? To your arms?
It radiates into my left shoulder.
Okay, your left shoulder. And then what's the severity on a scale of 1 to 10?
It's an 8 on a scale of 1 to 10.
Okay, an 8. And then how long ago did this happen?
About 2 hours.
2 hours, okay. And then I'm going to move on to my sample. So our signs and symptoms are the chest pain. So I'm going to move on to allergies. Do you have any allergies I need to be aware of, sir?
I'm allergic to morphine.
Okay, morphine. And then I'm going to move on to medical history, or medications. Do you have any medications, sir?
I'm on Novolog, Humalog, aspirin, and nitroglycerin.
Okay, so you also have some chest pain. Okay, and then we're going to move on to past medical history. Is there any history I need to be aware of?
I have diabetes, angina, and I've had 2 heart attacks in the past.
Okay, and then we're going to move on to last oral intake. What did you eat last?
A sandwich.
Okay, and then events leading up, so you were just mowing your lawn, correct? Okay, and then I'm going to assess the affected body systems. So this is obviously a circulatory system, since it's your heart. It's pressing chest pain, and then we're going to talk about when we need to reassess. And since you are a critical patient, I'd reassess you every 5 minutes, and then I would provide my accurate report to my arriving EMS unit. And sir, would you like to be transported with this unit?
Yes.
Okay, so then I would give all of this information that I've gotten from the patient to the transporting EMS unit.
You're set.